owner of the nursing home, we have a board of directors, and then we have the different departments. And then under each one of these departments, there's going to be another list. All right. So here we have nursing, because that's what we're focused on. We have our director of nursing, our nurse manager, our charge nurse, and our nursing assistant. Okay. So this is the chain of command. Nursing assistant has an issue, they're going to go to the charge nurse. Charge nurse needs additional help and needs additional information. Who are they going to go to? The nurse manager. Nurse manager is going to go to the DON, right? It's just like in school, right? You have an issue. Who's your first person that you go to? Your instructor, right? Whether it's myself or one of your on-ground instructors, clinical, sim, lab, right? If that instructor can't help you, right, then maybe you have an assistant director of nursing or assistant dean, and then your dean, right? And then, of course, you have your campus president, right? So it tells us, who not only who we report to, okay, but it also helps us to know, right? If the nurse manager isn't around, who do I go to? All right. Some organizations too will list all of the names. Okay. So they'll put who the DON is, who the nurse manager is, who the different charge nurses. So, like if there's 5 units under charge nurse, there may be 5 different lines here, each with a different name, and then all of the nursing assistants assigned to those units. This is, again, this is kind of what I was saying earlier, right? So different units, all right? You'll have your charge nurse, your UAPs, and your nursing assistants underneath, right? So again, some of them are going to be more specific, right? As people come and go, they may not want to keep the names up to date, right? But they'll definitely have an organizational chart so that you know exactly what your role is and where you fall into that company's scheme. So we have different things. We have leaders and we have managers. All right. And so they are different. Okay. Management and leadership, there's, when we look at management, we can, teach people how to manage, right? Managers are task oriented. They may be responsible for discipline. They, have some power and control. They instruct others. They are appointed by their employers. They have subordinates, they are supervisors, and they are responsible for goal setting and measuring. Leaders, on the other hand, are people oriented. All right. We can't teach somebody how to be a leader. Okay. So leadership skills are developed. All right. This is your personality and your experiences that help you to become a leader. They are motivators. They have a vision or they follow the vision of the organization. They have a strategy on how they are going to achieve that vision. They listen to their employees. They empower their employees. They have followers. They are delegators and they are goal exploring as well as goal reflecting. Okay. So again, your managers are, much more focused on specific tasks. So other differences, management, they coordinate people, time, supplies to make sure that we reach those desired outcomes in their area of responsibility, right? So nurse managers are going to have a specific, give me one sec. Why can't I move that? There we go. They are going to have, a defined area of, uh, you know, responsibility. So your nurse managers, maybe you have a manager for therapy, for dietary, for housekeeping, right? Everybody. They have an appointed management position, meaning that they have been appointed by the organization or their leadership. They also have a formal line of authority and accountability. Leaderships have the ability to empower, they have the ability to empower and influence the beliefs, opinions, or behaviors of a group or a person by guiding, motivating, and inspiring them to accomplish common goals and recognize their successes. And they don't always have formal authority, and some have the ability to influence others, which are what we call informal leaders. So, has anybody heard the term informal leader before? Nobody's heard. So, raise your hand if you're already a CNA or work in healthcare. All right. So, CNAs or working in healthcare, we all know that one CNA, right? That's been with the organization for 100 years, who knows everybody, who knows everybody, who knows where to go to get what they need, who to talk to, right? They know all the ins and outs of that one area, but they don't have a formal leadership position, okay? But they know, like everybody knows, when they need something, that is who they go to, right? We've all worked with people like that before. May not, that's what we call an informal leader, okay? They're not in an actual leadership position, but it is somebody that everybody goes to when they need assistance. So, preparing for that management or leadership. So, I'm going to say one thing, um, I don't know, maybe not everybody has had a position or not. Ashley, are you there? Can you take your background off, please? Um, Everybody has had a leader, and if you've had a job, right? Some of us have had really great managers. Others, maybe we've had some managers, right, that maybe haven't been the best, right? And when you're looking at developing your leadership skills, right, you're going to take all of those experiences that you've had in the past, right? And that is how you are going to develop your own leadership and management skills. So, what do you need to know? Obviously, the basic nursing skills, right? So, in order to be in a leadership or a management position, you need to have those basic nursing skills as well as be able to use that nursing process effectively. Time management. And I know everybody has heard about time management, right? Time management techniques for home as well as clinical time, right? So really, how are you going to plan out your day and ensure that you are going to get everything done within your time on your shift. You're going to need to know how to learn new information, including using evidence for learning and decision making. Power of positive self-talk and thinking. So, power of self-talk, right? These could, be daily affirmations that you do, right? How do you get, it's basically how do you get motivated, right? To be positive, to be a positive influence when you are coming into work and you are, leading a team of people. Rules for assertiveness. And we have talked about assertiveness versus aggressive communication, right? And behaviors, right? So being assertive, having really good communication skills, right? Communication skills are not just verbal, it's your nonverbal, it is your emails, it's, sending messages. Need to know the ethical aspects of healthcare, the legal aspects of healthcare, right? What are the rules and the of the organization? What are the accreditation standards? You need to have good problem solving and critical thinking skills. Stress management is another one. And as a future leader, when we look at stress management, it's not only just dealing with your stress, all right? It's dealing with the stress on the unit, it's dealing with your employees and your coworkers and their stress as well. And then participation in clinical evaluation. So as a nurse leader, as a charge nurse, you are going to be responsible for evaluating your CNAs. Okay, so you will participate in those clinical evaluations and providing feedback on your CNA performance. So we have different leadership styles. All right. So we have autocratic, democratic, and laissez-faire. What does an autocratic leadership style sound like? When you hear the term autocratic, what does that make you think of?
They
Like a
don't care
stern
about the
person.
staff.
Okay, very good. You don't care about the staff, right? You're barking orders, right? Danelle, you go do vital signs. Ramella, you're going to go do treatments. Janika, you're getting everybody's blood sugars. And Savannah, you're going to go pass all the medications, right? It's just, and then my CNAs, you're going to go do, right? It's very task oriented. It's, more of this is what you're going to do. That's
Uh,
it.
I think we was taught that you should do that like during a code. That's the like only time you should be like autocratic is during a code.
Right. Yep. Yes. Democratic, what do we think of when we hear the term democratic?
Is it like they allow others to help them to delegate the task?
Right, they work together, right? Everybody has a say in it, right? So, let's say we've had a whole lot of falls on the unit all of a sudden, let's all get together as a team, right? And discuss what are some things that we can do better, right? Give me your ideas, right? So it's the balance is the concern with the task, but also the employee, right? I want your feedback. What do you think that we could do better? And what does laissez-faire sound like?
Like
You
they
hear,
just let anything go on, like they don't really.
right? Yeah, like lazy, right? And
Mhm.
it's what it sounds like, right? So they just they're more concerned with the employees being happy. All right. So they're trying to please everybody. They're more concerned with the employee being happy than necessarily getting things done. So we'll break it down a little bit more. So autocratic, they don't share responsibility and authority with all employees. Their emphasis is going to be on those policies. Again, they tell employees what tasks to do. They don't have any input from the employees, right? So again, I think of the military, okay, because my military background, right? It's barking orders. It's, maybe not barking, but giving orders, right? Not expecting any feedback. And like Linda said, this type of leadership is necessary in certain situations, crisis situations, code situations, emergencies, right? We need to have somebody that is going to take charge, right? Because if you have a code situation and you've got 10 people in there trying to run a code and everybody's, you do this, right? You want somebody that's going to take charge. Same thing with the crisis, a tornado, a hurricane, a flood, right? You want somebody who is in that central command role to direct everybody to where they need to be and what they need to do. The laissez-faire style of leadership gives away responsibility and authority to the employees, and they are going to put those employee policy or employees before those policies, right? They want everybody to be happy. Okay. And that is the goal. That is you know, they just want everybody to be happy. Um, they may not accomplish anything, but the staff feels good. Now, in some cases, maybe a laissez-faire type of leadership style may be effective, right? When goals and policies are not a consideration, which is rare, okay? Because usually goals and policies are always in consideration. But we do know, um, or what about if you have a staff that is very motivated, okay, and they're goal oriented, right? Maybe they just come to work and they know exactly what needs to be done. They're following policy, they're getting things done. Then that leader can kind of step back a little bit, right? Doesn't have to be in there. They know everything is getting done. Most people like this type of leadership more so, right? So Democratic leaders, they share responsibility and authority with employees, right? So they enforce the policies, but they still have that concern for employees. And they are going to seek input from their employees. They encourage problem solving. And in long-term care, especially, this is important, right? Like I said, you have an excessive number of falls. You're getting all of these, pressure areas are developing, right? There's other concerns. Let's all sit down together, talk about it, come up with some ways to solve these problems. Because of the involvement with the employees, goals can be achieved and the staff will be positive. Okay, so when can we use this? We can use democratic style in just the normal everyday nursing situations during meetings, committees, reviewing care plans, right? We're encouraging that feedback from employees. And then we have situational leadership. And situational leadership is exactly what it says. It varying your leadership style to meet the demands of the situation and the work environment. Okay. Most people, we vary our leadership style depending on what is going on. Okay. So start off your day and everything is great, right? Everybody's doing what they need to do, and maybe you can sit back a little bit, right? You can have that laissez-faire and kind of just know that everything is getting done, all right? Or like I said, in those times where, we have an increase in, or, something happens and we need to make a change in something, right? We're going to bring everybody together and we're going to get ideas. Or could have that great day and all of a sudden now we have tornado warnings, okay? And we need to have that autocratic style to take over, to start directing staff to make sure that residents and staff and everybody is safe, right? So that is what situational leadership is. It's just your ability to change your leadership style depending on what is going on. And most people, like I said, are going to do this. Other things that we need to know for leadership: motivation. Leaders, managers need to know how to motivate their employees or their coworkers to make sure that we are getting those goals accomplished. They have to have really good communication skills, verbal, nonverbal, written communication. They have to be good problem solvers. So using that problem solving process, team building. And then, like I said earlier, we need to know about how to manage stress. Okay. So we look at all of those things together. Everybody has heard of Abraham Maslow before. I'm pretty sure, or at least I hope everybody has heard of Abraham Maslow before. All right. And so when we look at human needs, okay, all individuals have needs that must be fulfilled to meet their goals, right? Everybody is internally motivated to engage in activities to meet their needs. Okay. And so the activity that they engage in is our behaviors and usually can be observed. So with our Maslow's hierarchy of needs, we know that we have that nice little triangle, right? Okay. And, those basic needs are at the bottom. Okay. But, so we have the physiological, we have safety, we have love and belongingness, we have self-esteem, and then, of course, our self-actualization. When we use Maslow's hierarchy of needs, okay, meeting needs on one level of the pyramid acts as a motivator for meeting the needs on the next level. So what does that mean, right? So if all my physiological needs are met, right, that is a motivator to get to the next level to meet those needs, right? So once I meet my physiological needs, then that's a motivator to meet my safety needs, to meet my love and belonging, right? Continue to move up that pyramid. When faced with overwhelming difficulties like physical or emotional, some regression takes place. Okay. So, for example, that bottom level, right? Let's say you lose a job, you lose your housing, you don't have money for food, right? then you're going you to have obviously some regression back down that pyramid, and now we have to meet those needs, right? And so that is a huge motivator, right? And then, like I said, once we reach those goals, then we can move on to the next level. Safety and security becomes an issue if you're facing a serious illness, move into an unsafe neighborhood, facing a divorce, things like that. Okay, so again, right, meeting let needs on one level is going to be a motivator to meet the needs on that next level. So how do we apply this at work? Okay, so we know how we apply Maslow's hierarchy of needs to our patients, to ourselves, but how does this fit in to work motivators? All right, so those basic needs, when you graduate, you pass your NCLEX and you're going out to work, right? What are those things that we're looking for? Obviously, we want to know what our salary is, right? How much are we going to get paid? What are our benefits, right? Do we have medical, dental, what's the other one? Vision, right? Do we have life insurance? What are the working conditions? What is my supervision? What are the policies, right? You need to look at all of this, right? Before you ever accept a position. Once those basic needs are met, right? That's the motivator for the next one. And that's safety in the workplace, right? And then your job security, right? So, you come in, you do a good job, you build up that job security. And then, of course, that motivates you to develop relationships within your employment where you're working, right? Develop relationships with your CNAs, with your fellow nurses, with your leadership and management, as well as, right, the clients that you're working with. And that is going to push you, right? How do I get recognized? Is there growth available, right? And then again, achievement and advancement. So as you go, you can see, right? You get the basic needs met. And then as you go and you keep moving on, it is going to continue to push you, to motivate you to reach the next level within that hierarchy. So, motivation. All right. So, motivation, that's the drive that causes individuals to set personal goals and reach those goals, right? In order to come to nursing school, you had to have a motivator, right? Something had to motivate you to come to nursing school, right? Because it's not easy, right? Is there anything about nursing school that was easy? No, right? It is not easy. So, the motivation drives come from within an individual, and that is intrinsic. Okay. Those are motivating factors or satisfiers. All right. And so intrinsic satisfiers or intrinsic, right? These are things that increase job satisfaction and contribute to your personal growth. Okay. So things like achievement and recognition, the value of the work, the potential for growth and advancement, as well as responsibility, right? Those are all intrinsic. Okay. They have to do with the job itself, right? Your extrinsic factors, okay, these are what we call maintenance factors or dissatisfiers. All right, so they're a little bit different. These are things that would decrease your job satisfaction, all right, which could be a variety of things, right? It could be company policies, administration, supervision, salary, interpersonal relations, work conditions, right? Those are all the things that could potentially lead to you being dissatisfied with your job. All right. Other job satisfaction attributes, value. Do you feel valued when you go to work, right? What about growth, right? Are there opportunities for you to learn, to grow, to move up in the organization, right? To be able to do more. The fact, making a real connection. Who's ever worked in a place where you just come in, you do your job and leave. You haven't, the people there, you weren't able to build relationships with. It was just more of an uncomfortable situation. Has anybody ever worked in a place like that? Janika's like, yeah. Okay. Does it make you want to stay? So I'm assuming nobody else has ever worked somewhere like that, because if you don't get that warm fuzzy right in your belly when you go to work, does it make you want to stay? Right? If you can't build relationships with the people that you're working with, does that make you want to stay where you're at?
No, it makes the job actually more stressful.
Right. It makes it more stressful, right? You don't have people you can count on in a situation where you may need somebody, right? So that is something that we have to look at. And then, of course, empowerment. What is empowerment? What does it mean? What does empowerment mean? Can't even say the word. What does empowerment mean?
Like voicing words of encouragement, motivating your teammates or your coworkers.
Absolutely, right? It's going beyond what you're doing, right? The simple tasks are not even simple, but the tasks that you're everywhere to do, right? And so you're elevating your team. You want to get them to reach a different level, right? And so there's lots of things that we can do, right? One of the biggest things, and I'm going to tell you for those of you that are not CNAs or have not worked in healthcare before, okay, when you have your CNAs, please, thank you. Hey, you did a really good job today. Those are some key terms that you should use with your CNAs, because I will tell you, if you don't know this already, CNAs work very hard. Okay. They bust their butts. They are underpaid for what they do. Okay. And they deserve our respect. Okay. So, looking at ways to help motivate and empower people is really going to be key. Job dissatisfiers, talked a little bit about this already. Availability of equipment. Anybody worked in a place, or even how about a clinical experience? Have you gone to a clinical experience where there's not been enough linen, there's not been enough supplies for you to do
Yeah,
what you need
all
to
the
do,
time.
All the
right?
time.
So that's a huge dissatisfier, right? So I will tell you, because I was telling the other class, so I told you guys my background is long-term care and pediatrics, right? And so when I first moved down to Texas, got a job in long-term care, um, and I'm in orientation and I work skilled care. Okay. So skilled care is a little bit different than long term. And I have my list of residents, and I'm like, okay, got to go get vital signs. And I'm being oriented. This is like my first day of orientation, and I'm looking around the unit. And the other nurse that was orienting me, he's like, what are you looking for? Because you look really like, you're trying to find something. And I told him, I said, I'm looking for the vital signs machine. And he looked at me and he was like, we don't have those here. Okay, wait, what? He's like, we don't have vital signs machines. I'm like, well, then how do you get vital signs? Right? I think that's a logical question. And he goes and he pulls out and he has a little kit, and it had a blood pressure cuff, it had a thermometer, it had a pulse ox in there, and his stethoscope. And I'm like, okay. He's like, you have to have your own equipment. I was like, well, that would have been nice to know. That is not something that I would ask in an interview, because why? I come from an area of long-term care that we always had everything, all our vital signs equipment at our hands. Sometimes we ran out of thermometer probe covers, but we always had vital signs machine. So that was a big shock for me. And so, of course, I had to go out and buy my own equipment. But linen, especially for our CNAs, that is always a big thing. Trying to find ways to make sure that they have enough linen to do their job. Or it could be, do you have wound care supplies? I went to work one night and I had 4 people on IV antibiotics. Guess what I couldn't find? IV tubing. How am I supposed to do IV antibiotics if I don't have IV tubing? Okay. And the one nurse is like, oh, well, I left the IV tubing on the pole. Well, that was great, but the IV tubing that was on the pole for one resident, not for the other three, for one resident was a different antibiotic than what I had to give. And I can't use that same tubing. So little things like that, right? That could be a huge dissatisfier because you can't do your job if you don't have what you need to do your job. Unrealistic workload. All right. Again, I work skilled care. And so, usually with skilled care, you can have a lot of patients, right? But generally, my average is anywhere from 15 to 30. Okay. Just depends on what census is. All right. I worked at a facility, and I will tell you, not very long, where I had 60 skilled care residents by myself, 60 with 2 CNAs. And so to me, that was unrealistic, right? Because in that shift, that was 60 residents that I had to chart on, make sure that they got their medications, address any issues, because some of my clients were also very unstable, okay? Meaning that I had to keep an even closer eye on them. Or it could be, you have 60 residents, we're only going to assign you one CNA. Well, one CNA and one nurse for 60 residents, right? That to me is unrealistic. That is not inappropriate staffing. And then the regulatory demands. This can vary depending on where you're working, but this could also be a huge dissatisfier. Some places you go, you're going to just have, a minimal amount of charting to do. Other places you go, you may have a larger amount of charting to do. So in that 60 bed facility, that 60 beds that I had in that one facility, I timed myself uninterrupted. I don't know how that happened, but I did have one night where it was completely uninterrupted and I was able to sit down and do my charting. It took me 3 hours to chart on my 60 residents. That's 3 hours out of my shift, right? Now, granted, it was a good night, didn't have a lot going on. And that was a 1 in a million, okay? Because normally what ends up happening is when the next shift comes in, I am still charting, right? Because there just wasn't enough time during that shift to get everything I needed to get done, right? I had to worry about the residents and push the charting off to the last minute. We talk about communication, and we've talked about communication already. But this is a big thing. Okay. Your communication is everything. All right. So with verbal communication, when you're talking to your nursing assistants, especially, you want to be very clear, use very specific language with them. You want to tell them objectively what needs to be done for those residents. You're also going to be a role model for those nursing assistants. So be careful in how you speak. You don't want to use profanity. You don't want to use personal criticisms. You don't want to gossip. You don't want to spread rumors with your CNAs. Use those I messages. Remember, I messages is going to put the responsibility on you, not cause somebody to become defensive. And then even when you're talking with above those that are above you, your supervisors, your managers, okay, you want to be a positive force, okay? I don't want to say whiners, but okay, don't always complain. All right. If there is a problem, if there is something that you, I guess, need to complain about, come with a solution. Like, hey, I noticed this, this, and this. All right. But here is my suggestions for improving those things. Okay. So again, don't always be the one that's always just going with problems after one after another. Go with a solution as well. Your nonverbal communication, remember we talked about this, making sure that your verbal and your nonverbal communication are congruent, right? They're consistent as well as professional. And then, of course, when you're talking, always appear sure of yourself, right? Head up tall, sit up straight, be very attentive to your posture. With our written communication, use language that staff is going to understand. Okay, always review your messages before posting messages. All right, So you're not only looking for grammatical, you're looking for grammatical and spelling errors as well. Sometimes, it's easier if you read them out loud or if you have somebody else read them before you post them. If you have a group meeting, a team meeting, you always want to provide written reports as well. Telephone, right? Always be, if you're calling somebody or even answering the phone, you want to, make sure that you are using proper language, that you're speaking clearly so as to be understood. And then always use those active listening skills. We look at change of shift, or, change of condition reports. We've talked about these. When was it with communication when we talked about SBAR? Okay, so change of shift reports. These are just a quick visit of each resident to compare the status, right, with the, what's going on now versus what you got at report when you came on shift. And then change a condition. All right. Well, I'm going to say just depending on where you work, you may have a checklist to follow, or you're going to go and do your assessment and you're going to gather all of that information and you're going to use SBAR. So situation, background, assessment, and recommendation. And so make sure that you have all of that information. In long-term care, if it is a change from the norm, you will fill out a change of condition. Okay, so you need to have all the pertinent information that, that is going to go into that. So again, always know vital signs are going to be really important. Oops. All right, so we'll go back more to this team building. All right, stress management. So I said that you're not just going to deal with your own stress, but as a charge nurse, as someone who is a leader, okay, you are also going to have to deal with the stress of those that you are working for, okay? And so, what are some things that can cause stress in long-term care? Workloads. What if you are working and you've had 2 CNAs call out and you're not able to get any more CNAs in for that shift? Then that is going to cause some stress. Maybe there is conflict among your nursing assistants, your providers, families, residents, right? All of these things can cause stress. And stress and anxiety can result in dysfunctional behavior, and these are things that we need to worry about. So some things that, some of those dysfunctional behaviors would be decreased job performance of your CNAs, negative interactions among your nursing assistants, ineffective communication, listening to their communication styles. You can hear it a lot of times in the tone of voice, high staff turnover. And then, of course, then we worry about unhappy residents and families, right? And we don't need that as well. So again, you have the responsibility to be a stress manager and a role model for your team. Okay, so what are some ways that you as a nursing team leader or a charge nurse can help to manage stress on your unit?
Like activities, I don't know, breaks. Like,
Okay, making sure that your CNAs get their breaks. That is one thing, right? What else? What else are some ways that we can help decrease stress on the unit? Jamalatu, what are some ways that we can decrease stress on the unit? Can you hear me? Jamalatu. Okay, what are some other ways?
team meetings, like once a month, twice a month.
Yeah, team meetings. right? Got together, right? We used to call them start, stop, continues, right? So, what are some things that we can do better, right? What are some things that maybe we're not doing well, right? Or, wait, what does I say? What are some things that we need to stop doing? What are some things that we need to start doing? And what are some things that we are doing well, right? So we need to be able to identify the stress so that we can work with those members on the unit in order to, make it a more cohesive environment. So we have what are called the ABCD ways of increasing awareness and irrational thinking. Okay. And give me one second because I'm going to pull the example up in the textbook. And so I'm going to use the example in the textbook for this. This way, you guys, if you need to look at it, then you have that option. But the ABCD ways of increasing awareness of irrational thinking. So A is activating, B is belief, C is consequences, and D is dispute irrational thoughts. Okay, so here we go. So we have a nursing assistant has called in on the telephone. They said, I cannot come in today. I have a headache. All right. So in the LPN, the charge nurse's head, they're thinking, I'll just bet the headache is probably due to late night partying. Okay. Just saying. All right. So, how do we fix this? Okay. So, A or activating event. That activating event is the nursing assistant calling in sick with a headache, right? The B, the belief or the self-talk about the situation, right? The charge nurse thinks that the CNA was out partying, right? And that's why they're not coming into work. The consequences, then the LPN was abrupt with the nursing assistant on the phone. She allowed herself to feel angry about the absence. She allowed it to ruin her whole day. And then nursing assistants avoided her like the plague, right? Because I'm in a bad mood, so everybody's going to hear about it. And then D is dispute those irrational thoughts. Okay. Choose a more rational, assertive response to the situation. Okay. Focus on the objective facts. CNA has a headache. She's not coming in today. Okay. You want to avoid those self talks about the situation. Okay. And so, what should you say? Really? You know what? I'm sorry to hear that you have a headache. I hope you feel better after you get some rest, right? See you tomorrow, whatever it is. Don't let it ruin your day. I mean, even, maybe it was true, maybe it wasn't true, right? But you don't want it to ruin your day. We need to be rational with how we are responding with that. And it's going to happen. I'm going to tell you a story. So when I first got my RN, so I transitioned from LPN to RN. I was a charge nurse. I worked overnights. I love night shift. That's my thing. And so I started getting calls at like 4 o'clock in the morning. I was like, the phone was just ringing off the hook this day. And I was working 2 jobs. So I was working overnights. I didn't work full-time overnights. I worked part-time overnights, but I had a full-time day position in peds. Okay. So I literally had to leave. I had to leave work on time. I had to get home. I had to shower so that I could go to my other job. But at 4 o'clock in the morning, the phone starts ringing. And I'm like, oh my gosh. So I already knew. You know how you just know? So they were scheduled for 6 CNAs that day. By 6 a.m., I had already had 3 call outs. Okay. Which means I only had 3 CNAs coming in for that shift. So at 6 a.m., no, 6:30. I'm trying to remember. I don't even remember what our shifts were. I think it was 6:30 when the day shift came in. So 6:30 comes in. I am I had already done the CNA assignments for the day shift because I knew the day shift nurse was going to be late. So I figured I'd just go ahead and get that done. I let them know, hey, we're on a 3-person assignment right now. However, okay, staffing coordinator, I had already talked to her. She was trying to call some CNAs in for the day. So I did let them know. A few minutes later, the phone rings. I answer the phone. It's one of my CNAs that had already clocked in, had accepted their patients. She's on the phone. I answered the phone and she was like, "Hey, I just wanted to let you know that I left." Excuse me? And she was like, she goes, "I'm not working short staffed. I left." I said, "So you came in, accepted the assignment." And this is where I let it bother me. I was like, "You came in, you accepted your assignment. You can't just leave." She goes, "Yes, I can." I said, "You don't want to work short staffed, but you're going to make them work even more short staffed by leaving." And she's like, "Yeah, I don't care." I said, and this was like I said, I let it ruin my day because I was like, that you can be reported to the board of nursing for patient abandonment. And she said? She said, "That's okay. I've done it before." So yes, I let that ruin my whole day. Um, we have to understand that some things are
Can
going to
they can they take your license for that?
for patient abandonment, especially if it's a pattern of behavior. Yeah. Once you clock in and you accept your assignment, then that means that you have accepted that assignment. That is what you're going to do for the day. And from what I understand, then, I passed it on to the chain of command and she was reported to the board of nursing because she also no longer was employed with our company. So, yeah, but it was just one of those things like how, I had completely let it ruin my day. And of course, I also had to now deal with those poor two CNAs right now, because I think that facility was a 60-bed facility. And I think it was only long-term care at the time. And so I was like, there was a lot of, that's a lot of people. So, like I said, I let it ruin my day. And, now I had to explain to these poor CNAs, right, that instead of 3, now you're down to 2. And I still don't know, right, if we've got more people coming in to help. So creating that less stressful environment. So as a charge nurse, okay, you want to make sure the first thing that you do is organize your shift. Now, once you get out into practice and you go through orientation, you're going to understand some of the basic, some of what is going to be expected of you on your shift. So you want to make sure that you organize your shift. That helps to prevent some stressful situations. Okay. Make sure your nursing assistants have what they need to get their job done. Okay. So if it's linen, make sure that they have linen, that they have personal care supplies, all of that wonderful stuff. And somebody said it earlier, you want to make sure that your CNAs are taking their breaks. Absolutely, 100%. Make sure that you are seeing, that they are taking their breaks as scheduled. So what I would do is write, the CNAs have to be on the unit for meal times. And so I would stagger their lunches. Okay. And I would make sure like everybody went to lunch. Now, if you had to switch your lunch, that's completely understandable. But I wanted to make sure everybody got their lunch. Try to create a calm environment, right? Nobody wants a charge nurse, right, running around like a chicken with their head cut off, right? You want to maintain a calm environment even amongst chaos, okay? You want to try to always maintain a calm environment because you are the role model, you are the leader, okay? Your CNAs are going to follow your lead. And like I said earlier, always treat your CNAs with respect. Please, thank you. Hey, you did a really good job today. Now, if you need to pull them aside because maybe something is not, maybe they're not performing up to standard, this is something you may have to do first. And if you've never given feedback to somebody about job performance, one thing that I always do is it doesn't always have to be negative. All right. So when you're providing feedback about a situation that needs to be improved upon, start with something positive. Okay. So, Ramella, you did this really, really well today, right? You did this, this, and this. You did a really good job. This is something that you always perform well on. However, this is something that, this is blah, blah, blah. This is what we need to work on, right? So you can always start, right, with something positive, and then, discuss the needs for change. So we have those wonderful problem solving steps. Okay. So the problem solving steps is just another way that we, it's very similar to the nursing process. Okay. It is a way that we can use, a management technique that we can use for conflict resolution. And so conflict resolution, right, is just really just settling differences. Okay. And, when you have a group of people that work together, then it is very possible, right, that we are going to have some conflict. All right. Um, so the first step in the conflict resolution is collecting data. Okay. So when we have a conflict that arises, a lot of us want to just rush in and solve the problem right then and there. Okay. You need to step back. Okay. And you need to gather all the data. So if you have two CNAs that are arguing, you have two residents that are arguing, because that can happen too. All right. You want to separate the people from the problem. Okay. And so, take two CNAs, take two residents, you want to separate them, and then you want to talk to them individually. Okay. Get as much information. We know that there's two sides to every story, and we want to get both sides. All right. Make sure you're listening, and then gather all those facts. Then you want to identify what the issue is or define the problem. Okay, so after hearing all sides of the story, okay, then you can use those I messages like, okay, this is what I have heard you say. All right. And then making sure that you have accurately stated the problem. Then, of course, we're going to set a goal to how we are going to resolve the situation, and we're going to put interventions in place, just like we would with the nursing care plan, right? So how are we going to settle the conflict? How are we going to work together, right, to make sure that the job is done and it is appropriately? And then, of course, we always go back and evaluate, because that's always part of that nursing process. Go back and evaluate and say, all right, did it work? Did it work? Did it not work? And now, right, if it worked, fine and dandy, great, no worries. If it didn't work, then we can move on and redo our wonderful interventions to try to get where we need to get to. All right, whoops, two more slides and then we're going to take a break. Some other knowledge that you need for leadership. Okay, we talked about these at the beginning. You need to have those clinical skills. You have to have the knowledge. What is the documentation requirements? What are the legal aspects as well as federal regulations? In long-term care, there's lots of different regulations that you need to follow. We call it the big red book. It's probably about this thick. It's a really nice thick red book. Okay, it's going to give you all of the regulations from the Department of Health and Human Services, or what we call state. Okay, those people that come and do those yearly inspections. So want to make sure that, we're following all of those. Also need to have those organizational skills. So we talked about time management and conflict resolution. We also something called continuous quality improvement. Continuous quality improvement, or CQI. Okay, CQI is a really important part of healthcare. And so what CQI does, CQI, you may be invited to take part of one of the CQI meetings or be on a CQI committee, but it looks at issues and concerns, things that have already happened. So let's say you had, 5 falls on the unit this week. All right. So that CQI committee is going to get together. They are going to review the incident reports from those 5 falls and see if there is a common denominator within them. All right. Or, maybe there's not, but that team is going to get together and they are going to look at it to see, okay, what can we do better to prevent falls from occurring? Other things, the human relation skills, the ability to get along with and relate to people. So being able to deal with, have good anger management, being able to perform those evaluations with your nursing assistants. You need to be able to empower your team members, encouraging them to grow, increase confidence in your team members, and then always having a nice, wonderful, non-judgmental attitude when it comes to working with those teams. All right, so talked about all of the things so far. Well, actually, there's even more, but we're not going to discuss those right now. Those actually, we'll talk a little bit more about chapter 17 next week. But I mean, we're still talking about 17, but we're going to talk a little bit more about it next week as well. But right now, we're going to go into assigning and delegating. Okay, and this is a big part of or a lot of information that you really, really need to understand and know. And so before we jump into assignment versus delegation, I'm going to stop sharing for a second. We'll go ahead and take a break. Be back at 3:40.
Hi, Miss Jennifer.
Yes.
I just drop arthritis so I can get Tylenol. I'm closer to my house. So I just to let you know.
If you're driving, then you need to log off.
Yeah, that's what I'm saying. I'm gonna log off, but I'm like 3 minutes
Yes,
from my
log off.
house. Okay, thank you.
All right. All right. So now we're gonna go into assignment and delegation. Okay, so excuse me. These are some very important topics to understand. All right. And so we'll start with the difference. All right. We'll start with the difference between assignment and delegation. All right. So assignment is the distribution of work, right, among team members for the shift. Okay. So assigning is something that an LPN is going to need to develop, especially if you're going to be in that charge nurse. So activities here, they're consistent with their job description, their job position, their legal scope of practice, and their educational background. So again, that's why I said earlier, it's really important that if you're going to be supervising your CNAs, that you know what their scope of practice is according to their Nurse Practice Act. And when you are assigning, okay, that means that the staff member assumes responsibility and is accountable for completing the assignment, right? So if you're doing your CNA assignments and they have the group of patients, then they are responsible for providing care for those patients, right? Ultimately, it is their job to make sure that everything gets done. Delegation, on the other hand, is a little bit different. Okay. So this is the transfer of responsibility for the performance of an activity from one individual to another, while accountability for the outcome is retained by the delegator. So, for example, if I tell Zamira, hey, Zamira, I need you to go get a blood sugar on Mr. Jones in room 5. Okay. And Zamira says, okay, I'm going to go get the blood sugar on Mr. Jones in room 5. That means that Zamira has the responsibility to perform that activity, but I, as the nurse, am still responsible for her completing that activity as well as the outcome. Okay. So there's a difference between assignment and delegation. The person being delegated to must accept and must agree to the delegation. Okay. It is a very effective management strategy to use. Helps to ensure the accomplishment of cost-effective client care, which we know has been shown to increase client outcomes as well as satisfaction. So, okay. Where do you find information about delegation? All right. So, now, I'm going to say this right here. Okay. Your Nurse Practice Act. I've said it a couple hundred times probably over the last 5 weeks. So you really need to look at your Nurse Practice Act. Not every state allows an LPN to delegate. Okay. So be very mindful of that. And that is another reason why you really need to look at your Nurse Practice Act to make sure that it is okay for you to delegate. Delegation is not a required act, but remember, nursing is a team sport. It's not an individual sport. Sometimes you just can't get it all done by yourself. And so that is the purpose of delegation. Again, it's cost effective, helps with time management. You also can look at your state board of nursing. Okay, so whatever state you are in, you can go to your board of nursing website. They may offer some guidance about delegation as well. And again, like I said, can't say this enough, Nurse Practice Act. So you need to understand the legal scope of practice for your CNAs or your UAPs before you can delegate. And why do I say that? In different states, that means that they may have different things that they can and cannot do. Okay. Some states, a CNA can do a blood sugar. Other states, CNAs cannot do blood sugars. Some states, CNAs can do tube feedings. In other states, CNAs can't do tube feedings. Okay, so you have to know what their legal scope of practice is. Other resources, of course, is going to depend on rules, regulations, guidelines, memos from your state board of nursing. NAPNES is another one. There's a standards of practice and educational competencies. Your NALPN, which are the nursing practice standards for your for LPNs and LVNs. Policies and rules on delegation by your employer. And the NLN also has some really good information on delegation. There are rights to delegation, just like there's rights to your medication administration. All right, there are the 5 rights of delegation. All right, and so it is super important that you understand these 5 rights and that you can put them into practice. Okay, so we have the right task, which is a huge part of this. Okay, so the right task, the delegated task, must conform to established guidelines. Okay, what do I mean by that? Again, you're going to look at your laws, you're going to look at your policies, you're going to look at the unit, the condition of your residents, as well as what the training of your nursing assistants are. Okay, and that the task that you are assigning, right, is within their scope of practice. The right circumstances. So when we look at the right circumstances, you have to assess your client before you go and delegate a task. Sorry. Okay, so the resident has to be stable. All right, you cannot delegate a task to an unstable client. Those delegated tasks do not require independent nursing judgment. You are simply asking them to perform a task and to bring information back to you. Your nursing assistants are not trained to make independent nursing decisions. Okay. The right person. Okay, this also is going to be something that you are going to learn as you start working with your CNAs. You need to decide who is qualified and competent. All right, so when you're working on the unit, you have a group of CNAs. You're going to get to know, right, the good, the bad, and the ugly, right, of that unit and the skills and abilities of the CNAs that you are working with. You also need to, right, give the right direction as well as the correct communication. So again, being, right, really good with your communication skills is going to be necessary. Okay, so you're going to give a clear explanation about the task, the outcomes, and when they need to report back to the nurse. Okay, so clarify the timeline as well as the expectations. You don't want to just tell the nursing assistant what to do. Okay, obviously, a discussion is, more effective. Okay, you want to tell them exactly, what must be done. Maybe, like I said, give them a timeline and expectations, and then what to report back to you. All right. So what, once you have them, just tell them what the task is, what information do you need to bring, need them to bring back to you. And then you need to provide the right supervision, feedback, and evaluation. Okay. So this is also really important as well, right? So you still need to monitor, intervene, and evaluate as necessary. All right. Give them feedback, hey, really good job. You gave me the necessary information that I asked for. You also want to go back and recheck your client. All right. Make sure that everything is good with your client. If you don't supervise them adequately and appropriately, and that resident gets harmed or injured, okay, then it could result in either a civil case or even disciplinary action against your license. So when you are delegating, you want to make sure that you are following these 5 rights. And so look at it. A lot of people like visuals, but this kind of gives you an idea of how everything kind of comes together, right? There's an overlapping process. All right. So employer, nurse leader responsibilities, right? Determine nursing responsibilities that can be delegated to whom and in under what circumstances, develop delegation policies and procedures, evaluate the process, of course, to promote positive culture and work environment. The LPN's responsibility, determine patient needs, when to delegate, ensure availability to delegate, evaluate outcomes, and then the delegatee responsibilities or who you are delegating to. They accept the activities based on their competence levels. They maintain competencies for competence for delegated responsibility, and they maintain accountability. Okay, and you can see how they all interplay together. So why again is delegating important? Okay, it increases your effectiveness and your efficiency as a charge nurse. Again, like I said, nursing is not an individual sport, it is a team sport. Okay, everybody needs to work together. It helps to realize client outcomes in a cost-effective manner. And it also helps your CNAs increase and improve their job skills. Okay. And that is one of those effective things with leadership, right? We want our employees, our coworkers, we want them to grow. Okay. We want them to improve their skills, so that they have the opportunity for growth and advancement as well. So again, delegation, you must assess your client. They have to be stable clients. You cannot delegate a duty to an unstable client. CNAs cannot delegate. Okay, so if Ashley is a CNA, she can't delegate a duty to another CNA, a nurse. Okay. Delegation also cannot be transferred. So if I ask Shahada to go get the glucose levels on room 5, then Shahada can't go to Zamira and say, hey, go get that glucose level on room 5. Okay. So it can't be transferred. The delegatee, or the person that we are trying to delegate to, okay, can refuse the delegation. But it is very important that if I ask Shahada to go get that glucose levels or that glucose level, and she tells me no, I don't want to go get that glucose level, it is very important to ask why. Okay, there is a difference between I don't want to do something and I do not know how to do something, right? For proper delegation, the function must be voluntarily accepted. Okay, so I can't make somebody accept a delegated responsibility. It has to be voluntarily accepted. And always use the nursing process, right, when we are assigning tasks or delegating. That is going to help you. You also can always collaborate with the registered nurse, right? Go ask the RN, hey, what do you think if I delegate this, right? It's always good to just get with the RN and see if it's a good idea. Some of the legal aspects about delegation. Again, Nurse Practice Act, I feel like I'm like on repeat. Okay. Delegate only if it is allowed by your Nurse Practice Act. Okay. And your facility policies. Always go back, make sure you assess your client. Shahada, add your last name on there, please. Shahada. Shahada, put your last name on, please. Only delegate duties for which nursing assistants have demonstrated ability, right? So if they don't know how to do a blood sugar, really that's a good time to teach them if that's within their scope of practice, right? In accordance with the policies. But if you have a CNA that is really good at something, right, that's usually going to be the one person that you're going to go to. Make sure that you are providing specific, objective, clear-cut directions to nursing assistants for for those delegated duties. Provide assistance and instruction when you delegate a duty, okay? And then you want to monitor those activities when they carry out the delegated duties. All right. So this could be anywhere, this could mean that you're standing right next to them when they do it, or it could just be that you're doing a periodic check. You want to make sure that if it is a safety issue, that you intervene as soon as possible. Once the delegated duty is done, again, you're going to go back, you're going to evaluate the effectiveness and the safety of the duties. This is that legal spot, that legal stuff. If you delegated improperly and a resident was harmed, right here, you are liable, okay? And that can result in disciplinary action against your license and or a civil suit. So for example, I'm going to throw something out here completely out of the, out of the blue. Let's say you have a nursing assistant that's working with you and they're in nursing school, okay? And Mr. Jones needs his IV started. Can you ask that CNA? Can you delegate that IV start to that CNA? No, absolutely. Thank you, Danelle. Yes, you cannot. That is not within their scope of practice, right? They can't start IVs. But let's say you're like, oh, girl, I know you're in nursing school. Go ahead and hang that IV. I know you're okay. And that patient gets harmed, then you are responsible for that, okay? You are going to be liable if they get hurt, okay? Now, on the other hand, if you delegated properly and you were continued to monitor and the client was injured, the nursing assistant's going to be liable as well. Okay, so let's say that glucose that I said that we needed, okay, let's say you go in and that it was, done correctly, got the, stuck the finger. Well, let's say that Mr. Jones developed a thing, an infection in his finger and ended up having an amputation. Okay. Then both the nurse and the CNA could be held liable in that situation. Again, delegation should always occur in collaboration with an RN. And according to the American Nurses Association and the NCSBN, the RN also should follow the 5 rights of delegation. So right task, right circumstances, right person, right direction and communication, and of course, under the right supervision and evaluation. So what can we delegate? Okay, so here are some of the things that we can delegate. Personal care. So hygiene, dressing, toileting, grooming, skincare, all of that wonderful stuff. Feeding and hydration. Basic restorative skills, transferring, positioning, ambulation, range of motion, vital signs, height and weights, INOs, helping them with elimination, and that includes catheter care. Okay. Safety factors, fall prevention, heat and cold application, prevention, infection prevention measures, and then collecting specimens for urine and stool only. Okay. So those are some of the things that we can delegate. Hey, Mr. Jones, I need to get a urine on Mr. Jones, whatever. So those are the things that we can delegate. What can't we delegate? Okay. Complex sterile technique procedures. Nursing assistants do not have in-depth training in sterile technique. Okay. So you can't have them can't have them starting IVs. You can't have them putting in Foley catheters, certain dressing changes. Again, no sterile techniques. Can't delegate in a crisis situation. So let's say then CNA comes to you and says, hey, Mr. Jones is having chest pain now. Gemalatu. Gemalatu. You need to add your name on there. Gemalatu. Okay, so an example, again, like I said, Mr. Jones starts developing chest pain. The CNA comes and tells you, hey, I'm having chest pain. You cannot say, oh, can you go grab his vital signs for me? Okay, that is a crisis situation. There is something going on with that resident. Again, you cannot delegate that duty. Also, we know that initial client education cannot be delegated. The RN is responsible for initial client education. All right. Most states, LPNs can reinforce initial teaching. Again, cannot provide initial teaching. Although nursing assistants can collect simple data, they have not been trained to make decisions about or interpret the data. Okay, so they don't know if they need to go back and recheck that blood pressure or recheck that glucose level or what to do if the glucose level is high or low. Okay, they are only going to collect the data and bring it back to you. And then, of course, when delegating, like I said earlier, the responsibility must be within their authorized scope of practice under that Nurse Practice Act. And even though you are delegating a responsibility or you're delegating that task, you are still ultimately responsible for that task to be completed correctly and appropriately. So we're going to, this last slide here, and then we're going to do some practice questions. But other things that you can do as an LPN once you graduate and you start working in, in your practice, what can you do to help increase your employment opportunities? One, get certifications. All right. So there's IV certification courses that you can take. There's long-term care certification. I want to say, if I remember correctly, the minimal requirement is 1 year in long-term care. It is an exam, so you will have to take an exam. All certifications require an exam. And then anytime you get a certification, just as an additional, there are a specific amount of CEUs or continuing education units that you will have to perform every year in order to maintain as well as renew your certifications. And wound care. Anybody like wound care? Samira's like, no. Danelle or Jaquan's like, yeah, maybe. I love wounds. Oh my gosh, I love wounds. I don't know why I never did wound care. Like so I would do wound care, but I was never like a wound care nurse. And so yeah, I love wounds. I hate the fact that people get wounds. I'm gonna put that out there. Like, I think it stinks, like it's horrible. But if you have one, like I am all on top of it. But that is something LPNs can do as well. Other things, go to seminars, do leadership courses, go to in-services. And I know, oh my gosh, don't want to go through training. Like I have so much to do. These are all things that are going to help you increase your employment opportunities, gain knowledge and experience. You can read books and articles. I will tell you, your nursing journals have a wealth of information in them. I know sometimes, can be a little expensive, but a lot of organizations will subscribe to nursing journals so that you can have access to them. And network. Okay. Networking is great. All right. If you're going to go work in a hospital, you're working on med surge, go meet people from the ICU and other units, right? And network, right? The more, more people right? Sometimes it's who not what So really put yourself out there and network, learn about other areas within, healthcare, things that you might be interested in. And then that will help you increase your employment opportunities. There's lots. And it's funny because when I first became an LPN, like forever ago, okay, they said, oh, we're going to phase LPNs out. They're not going to be around for a while, for much longer or whatever. Right. Guess what? We know that LPNs are a huge part of healthcare and they're very much needed. And so who wants to go back and get their RN when they're done with their LPN? Anybody? There's a few of you that do. Okay, awesome. Right? Always look for opportunities for growth. Look for things that can help you achieve your goals. A lot of organizations now, and I think this is awesome. They have, it's not, oh, what is it? It's not is it tuition reimbursement? No, it's not tuition reimbursement. It's student loan reimbursement or something along that line. But basically what that means is they'll help you pay back your student loans. And I don't know about y'all, but I wish I had a job to help me pay back my student loans. Like that would be awesome. So like my daughter works for a hospital system and they didn't have it at first, but they have it now. And so they make her student loan payment every month for her. And so what she does is she lets them make their payment and then she'll also make a payment. So it's like a double payment every month to try to help her get it paid off sooner. So look for those types of opportunities, right, as you are going out into the workforce. All right. So I told you we're going to do some practice questions. So I forget how many questions are here. So I have some questions here, and then I can also pull up some additional questions. So all right, I need everybody to answer. All right, so you can either answer in the chat or you can answer out loud, whichever is easier for you to do. I'm going to pull open the chat. Let's see. Gemalatu, you need to add your last name on your login. All right, why can't I make my chat bigger? It's not working for me. All right, there we go. All right, so like I said, I'm going to share my screen. You can either say the answer out loud or you can answer in the chat, whichever is going to be easier for you. All right, so I got to share. All right. All right. So go through some initial stuff just as a recap. All right. Remember, delegation is necessary. Okay. Can't do it alone. Again, nursing is a team sport, not an individual sport, right? Allows you to multiply yourselves. Okay. Helps you save time. All right. So what do you need to know? Talked about scope of practice ad nauseum, right? So you need to know your scope of practice and job description of anyone you delegate to, know the condition of the client, and follow those 5 rights. Okay? So here we go. Which of the following clients would the RN delegate to the LPN? Okay, so this is the RN now delegating. A post-op client who just came out from the OR, a new admission from the emergency department, a 3-day-old chest pain, or a client receiving an insulin drip. Which one of those can the RN delegate to the LPN? Okay. All right, just waiting on everybody else. All right. Which one could the RN delegate to the LPN?
1.
Got 1. Got a
1.
bunch of 3s. Got a 4. All right. It's waiting on a couple more people to answer the question. All right. All right. Let's click on down. Ta-da! 30-day-old chest pain. Okay. So remember, the RN has to follow the same rights, 5 rights of delegation as the LPN does, right? So again, when the RN is delegating to the LPN, client must be stable, all right? A post-op client who just came from the OR is not a stable client, right? There's still plenty that can go wrong with that client. A new admission from the emergency department, right? We have to do that admission assessment, right? Get everything going. So that would be something the RN would need to do. And client receiving an insulin drip, that is also something the RN would need to follow. So that 3-day-old chest pain, right? Probably the most stable of those. All right. Which patient with a health problem related to GI cancer would be the most appropriate to assign to an LPN? So, a patient who needs a blood transfusion secondary to GI bleeding, a patient who needs enemas and antibiotics to control GI bacteria, a patient who needs pre-op teaching for a bowel resection surgery, or a patient who needs central line insertion for chemotherapy.
Two.
Okay, got twos. Seems to be twos all the way around. All right. So yes, absolutely. Right, blood transfusion, going to be an RN. Pre-op teaching, right? That initial teaching is going to be the RN. And then, of course, the central line insertion. It's probably not even the RN. It's probably going to be more like your PICC line team, right? Somebody else. So yeah, patient who needs enemas and antibiotics to control GI bacteria. All right. The assistive personnel reports to the LPN that a patient's urine output for the past 24 hours has only been 360 mLs. What is the nurse's priority action at this time? So 1, place an 18 gauge IV in the non-dominant arm. 2, evaluate the patient's head, or I'm sorry, elevate the patient's head of bed at least 45 degrees. 3, instruct the AP to provide the patient with a pitcher of ice water. Or 4, contact and notify the healthcare provider immediately. I like this one.
Four.
So 4, got some 4s, 3s. Got the same people answering. Everybody needs to try. All right, let's see. I'm gonna flip it. Yes, we are absolutely going to contact and notify the healthcare provider immediately. That is a significant issue. What is the minimum urine output that we want to see hourly?
30.
Right? 30 mLs per hour, right? So that's the minimum, right, to maintain kidney function, which is about 720 mLs over a 24-hour period. So that's less than half, right? So that's pretty significant. So yes, the first thing that we want to do is contact that healthcare provider because that's a significant change. Now, providing the patient with a pitcher of ice water may also be effective, right? Get them to encourage them to drink, but first we need to notify that healthcare provider. All right, this one, select all that apply. So which actions should the LPN delegate to an assistive personnel for the patient with diabetes? Okay, so 1, checking finger stick glucose results every hour. 2, recording I&O every hour. 3, measuring vital signs every shift. 4, assessing for indicators of fluid imbalance. 5, notifying the healthcare provider of changes in glucose level. Or 6, assisting the patient to reposition every 2 hours. What can we delegate to those assistive personnel? Assistive personnel.
1, 2, 3, and 6.
1, 2, 3, and 6. Okay. 2, 3, and 6. All right. We've got a bunch. All right. So 2, 3, and 6. Absolutely. So recording I know every hour, measuring those vital signs, and assisting them to reposition every hour. Absolutely. Can assess, right? And they're not going to call the healthcare provider. All right. Here we go. We have 4 patients that arrive simultaneously at the emergency department. Which patient requires the most rapid action by the triage nurse and LPN assisting to protect other patients from infection? So we have a 3-year-old who has paroxysmal coughing and whose siblings have pertussis. We have a 5-year-old patient who has a new pruritic rash and possible measles. We have a 62-year-old patient who has an ongoing methicillin-resistant Staphylococcus aureus or MRSA abdominal wound infection. Or we have a 74-year-old patient who needs tuberculosis testing after being exposed to TB during a recent international plane flight.
We actually had this question before in capstone. I think it's 2.
2. It is. Why is it 2? See, I knew I was going to ask that question, right?
The new onset federation.
And then how is it spread? How is measles spread?
Airborne.
It is airborne. Absolutely. Yep. Last thing we want is a measles outbreak, right? All right. LPN is caring for a patient with osteoporosis who is at an increased risk for falls. Which intervention should the nurse delegate to the assistive personnel? 1, identifying environmental factors that increase the risk for falls. 2, monitoring gait balance and fatigue levels with ambulation. 3, collaborating with the physical therapist to provide the patient with a walker. Or 4, assisting the patient with ambulation to the bathroom and in the halls. Whew. All right. Bunch of 4s. Absolutely. Yeah. So making sure that we're, since they're at risk for falls, we want to make sure that we are assisting them with ambulation, right? So that, we can maybe try to help prevent the falls from occurring. All right. So the charge nurse observes an LPN or LVN assigned to provide all of these interventions for a patient with Paget's disease. Which action requires the charge nurse intervene? So 1, administering 600 milligrams of ibuprofen to the patient. 2, encouraging the patient to perform exercises recommended by a physical therapist. 3, applying ice and gentle massage to the patient's lower extremities. And 4, reminding the patient to drink milk and eat cottage cheese. So if we saw these, when would the charge nurse need to intervene? All right. Got a bunch of 3s. Trying to pull up more questions. For some reason, my textbook is not working. Correct. It is 3. What is Paget's disease?
And it like a bone disease.
A bone disease. Okay. And what happens with Paget's disease? Does anybody know?
Their bones get weak.
Okay. So why wouldn't we apply ice and massage?
Because it could cause more trauma to the fragile bones and
Yeah.
increase risk of fractures.
So it says here it's a chronic disorder causes bones to grow larger and become weaker than normal. Okay, so old bone is replaced by new, weaker, deformed bone. Okay, and so if we were, oh my gosh, can't even talk. So we don't want to massage because yes, it can cause more issues. Can't even get that out. So remember, if you don't understand, if you get the problem wrong, the action is going to be wrong. So it's really important that we understand what, right, the question is asking. All right, I'm trying to see now. I finally got. All right, so I'm gonna pull up. We got 20 minutes. Do you guys need a break real quick? Anybody need a break? All right, be back at 4:30. All right, let's do some more practice questions. So again, you can answer out loud or you can answer in the chat. Either way is good. I'll share my screen. All right, so this first one is going to be a select all that apply. So for a patient with a tracheostomy, which duties can the nurse safely delegate to assistive personnel? Okay, so which ones can we delegate to assistive personnel? So hold the trach tube when the nurse is changing the ties and the tube holder. Instruct the patient on how to cough effectively to remove secretions. Gather the tracheostomy supplies or supply kits prior to the dressing change. Checking the tracheostomy cuff pressure with a manometer. Assisting the nurse in delivering oxygen before and during sterile suctioning, and or 6, auscultate the lungs before and after suctioning the tracheostomy tubes. So what can the nurse safely delegate to a UAP? All right, so the answer I have are 1, 3, and 5. So we're just going to go with those. All right, so that is correct. Okay, the assistive personnel can hold the trach tube when the nurse is changing the ties in the holder. Okay, they can gather the supplies, right? Because that doesn't require any kind of independent nursing judgment. And they can assist in delivering oxygen before and sterile suctioning, right? It says sterile suctioning. So the nurse needs to maintain sterility. Okay, so they can, of course, assist with delivering oxygen so that allows the nurse to stay sterile, right? They can't auscultate, they can't check the cuff pressure, and they can't instruct. All right, next one. A student nurse is assigned to a student nurse is assigned to a patient with pneumonia. Okay. Which statement by the student nurse regarding how to obtain a sputum specimen should the nurse correct? Okay. So 1, I will obtain the specimen right after my patient receives his nebulizer treatment. Number 2, I will ask the patient to take several deep breaths, cough, and spit in the cup. Number 3, I will use a sterile specimen cup. Or 4, I will make sure the mouth care has been given prior or given before the procedure. So which one of those would require the nurse to correct? Right. So let's see. 1, 2, we got 3 1s. We got a 2, and then we got a couple 4s. All right. So 1 has the majority. So I'm going to select 1. So the correct answer, sputum needs to be coughed up from the respiratory tract. So the patient should be told to forcefully cough and expectorate into a sterile specimen cup. Because saliva will be mixed in with the sputum, the patient's mouth should be cleaned and rinsed with water prior. The best sputum specimen is taken first thing in the morning before breakfast. Okay, so the correct answer is I will ask the patient to take several deep breaths, cough, and spit in the cup. All right. Next one. The charge nurse has delegated reading the labs of a patient with COPD to a float nurse. The patient has the following ABGs. We have a pH of 7.35. We have a CO2 of 48, an O2 of 80, a bicarb of 28. The float nurse is unsure if he should take any further action based on the ABGs. Which course of action should the charge nurse suggest? So 1, suction the patient. 2, increase oxygen to 3 liters. 3, notify respiratory therapy for PRN breathing treatment, or continue to monitor the patient. Okay, so we have a COPD patient, and they have the following ABGs: pH of 7.35, CO2 of 48, PaO2, this is incorrect, of 80, bicarb of 28. What should we do? All right, for those that are answering, we'll go ahead with 4. So, yes, here's your normal ABGs. So, pH 7.35 to 7.45, O2 75 to 100, CO2 35 to 45, bicarb 22 to 26. Remember, COPD, they are going to retain CO2. So, it is expected that their CO2 may be a little bit high, and their pH is going to be a little bit more acidic, right? Because they are retaining CO2. All right. The bicarb is also going to be higher, right? Because that's going to try to compensate. So again, we're just going to continue to monitor. All right. The nurse has delegated all the personal care of her patients to the assistive personnel. Which of the following situations would warrant the nurse to give additional guidance to the assistive personnel? 1, a patient with COPD who is reclining in a chair at a 120-degree angle. 2, a patient with tuberculosis in a negative pressure room with the door closed. 3, a patient on a clear liquid diet who is eating a popsicle. Or 4, a patient with viral pneumonia being transported to X-ray with a surgical mask on. All right, so those who have answered, the majority is 1. So yes, I've had this question before. Absolutely. Okay, patient with COPD, they should not be reclining at a 120-degree angle. They should be in a Fowler's position, right, or leaning forward. All right. I like this one. All right. The nurse is caring for a post-op patient with a tonsillectomy. Vital signs upon return to the unit were temperature 98.7, pulse 76, respirations 20, blood pressure 134/72, O2 sats 98% on 2 liters of oxygen, and have remained stable for the past hour. Which post-op duty should not be delegated to the assisted personnel? 1, check vital signs every 30 minutes for 2 hours. 2, position the patient in a semi-Fowler's position. 3, assess the patient for frequent swallowing. Or 4, place an ice pack around the neck, which cannot be delegated to the assisted personnel. All right, good job. Yep, assess, right? We know assisted personnel cannot assess. Very good. All right. We got time for one couple. All right. The nurse and an assisted personnel are assigned to a patient on mechanical ventilation. Which action should the nurse delegate to the assisted personnel? 1, assessing the need to suction the ET tube. 2, assisting the respiratory therapist while obtaining an ABG. 3, evaluating the response to a medication. Or 4, cleansing and reapplying a transparent dressing to a stage 1 pressure injury. Which can we delegate to the AP? All right, so we got, all right, just for lack of time. So, yes, the AP can assist the respiratory therapist as needed, but cannot assess the need for suctioning or evaluate a medication response. And as far as the dressing goes, that should be done by the nurse, right? So they can evaluate that wound. All right, good job, guys. Any questions?